Hello friends, welcome to my new video. So today in this video, I'm going to discuss with you all about some basic terminologies used in medical field. Okay, so as we are in medical field, so we need to know every basic terms specifically. Okay, so there are many terms that we often get confused and use one term in place of another. So it should not be done. Okay, so let's start. So our first term is disease. Okay, so there is many people who get confused about this term disease disorder. Okay, so disease means or disease is basically an abnormal condition which create a negative effect in the body. Okay, which is basically without any injury. Okay, so disease is associated with sign and symptom. So you can see I gave a picture here, that is heart disease and this is cholesterol. Okay, so heart disease can lead to heart attack, increased blood pressure or decreased blood pressure. So it's a disease. Okay, it can be due to any factor, or it can be due to genetics or hereditary. So that is a disease. So disease can be due to an infection or it cannot be due to an infection, or sorry, that means without any infection it can be there. Suppose you are having cholesterol. Okay, increased level of cholesterol lead to blockage of the blood flow. Okay, which can lead to heart attack. Okay, so that's also disease. Diabetes, increased level of sugar in the body. Okay, so why this is there? So it is due to decreased production of insulin, so that the glucose level is increasing, which can lead to certain symptoms in the body. Okay, uh, so disease can lead to symptoms and signs, and it can due to any systemic problem, any hereditary problem, or it can be due to an infection also. Okay, so disease are two types: congenital disease and acquired disease. Congenital, that means disease which are present from by birth. Okay, so here in this example I gave here, there is hemophilia. Hemophilia is a disease where if you have a cut in your body, then blood flow will not get coagulate easily. Okay, so this is a hereditary disease. So it is not due to an infection or it is not due to an injury, but it is still present in the body. That is abnormality. So it is a disease. Okay, and acquired disease are communicable or infectious disease, and non-communicable or non-infectious disease. Here contagious and non-contagious. So contagious means disease which can spread, and non-contagious means that will not get spread by coughing or touching or kissing these. Okay, so if you are having a smallpox or ringworm, then this disease can spread from one person to another person by touching. Okay, by using the cloths or sharing things. Okay, but malaria, tuberculosis cannot spread by sneezing, touching. Okay, so if someone is having malaria, then this is the cycle that I gave here, that first of all this is a infected mosquito. Okay, which is the carrier of Plasmodium vivax. Okay, so this infected mosquito bit a first infected person, a person, and he is get infected, and he is get infected, and the Plasmodium vivax, that is a parasite, is injected in the body of that person. Now that Plasmodium vivax, that parasite will start to multiplication process, and it will increase in number. Okay, so when another mosquito will bite this human, then that mosquito will get infected, and he is a carrier. Now he is a carrier of Plasmodium vivax, and he again bite a normal human being who is not having that Plasmodium vivax in his body, but after getting bitten from the mosquito, then he is affected with malaria. So this is how malaria spreads. So it is a disease as well as it is an infection. That is why we can say it is an infectious disease. Infection means that the microorganism or multiplication of microorganism is there in the body. Okay, so that is infection. It can be fungus, it can be bacteria, or it can be virus. Okay, so another thing is a non-communicable or non-infectious disease. Okay, here degenerative organic disease like heart disease. Okay, deficiency disease like scurvy, rickets. So deficiency disease means deficiency of specific element in the body. Okay, like deficiency of vitamin D leads to ricket. Okay, and deficiency of vitamin C leads to scurvy. Okay, so these are the deficiency disease which is due to deficiency of any element. Now allergies is also a disease which is due to abnormal functioning of the body cells. Okay, and cancer is also a disease which is due to radiation or any mutation in the body. Okay, it is not due to an infection or injury. Okay, now so these are the types of disease. Okay, now let's move to another type. Before moving to this, this is the picture of hemophilia, where you can see in this picture that there is bleeding from the blood vessel. Okay, so for this to stop this bleeding, there is a blood coagulation is there. Okay, but that blood coagulation is not enough to stop this blood flow, and blood again is flowing. So this is hemophilia. This is a genetic disorder, or this is a genetic disease. Okay. So disorder, what is disorder? From this name we can easily understand disorder, that means it is not in proper order or form. Okay. So there is disorder. So disorder, it is the disturbance in the structure and function of an organ due to hormonal imbalance in the body. Okay. So that is disorder. So suppose a gland is producing hormone, but due to any reason the gland is now not properly forming the hormone, okay, which leads to some abnormalities in the body, like thyroid. Thyroid produce T3 and T4 hormone, okay, which is very much essential for body metabolism. Now thyroid is producing more T3 T4 hormones than the normal, then it will lead to certain changes in the body. Okay. So disorder means thyroid gland, and that in abnormal condition it is not in a proper order, which leads to some changes or abnormal symptoms in the body. Okay. So this is a disorder. So example is Graves' disease. So Graves' disease is due to overaction of thyroid gland. Okay. This is a normal human being, and this is a hyperthyroidism affected human being. So here you can easily differentiate how this normal thyroid look like and how this disordered thyroid gland is look like. It is not in proper order. Okay. So this is disorder. Now infection. Infection, as I said earlier, that infection means the innervation and multiplication of a microorganism like bacteria, virus or fungus in the body, which lead to some abnormal function of the body mechanism, is known as infection. Okay. So example is bacterial infection, viral infection, fungal infection is there. So bacterial infection means there is bacterial infection in the eye, like bacterial ulcer is there, viral infection like flu is there, and fungal infection like dermatitis. Okay. So there is ringworm is there. Okay. So these are the infection which is due to microorganism. Microorganism means those organisms which cannot be seen in the naked eye. Okay. So these are microorganism, and due to those microorganism, if there is some abnormal situation is happening in the body, it is known as infection. Okay. So this is the picture of bacterial corneal ulcer. Okay. So this is due to bacterial infection. This is an infection. Okay. So infection leads to abnormal changes in the body, which can lead to infectious disease. Okay. So in somewhere it is related, they are interlinked with each other. Okay. Now we are moving to syndrome. What is a syndrome? Syndrome means there is a group of symptoms is present in the body. Okay. That is syndrome. So a syndrome is a set of medical signs and symptoms which are correlated with each other. Okay. Example, Down syndrome. Down syndrome means chromosome 21 disorder, where there is abnormal multiplication of chromosome in 21 number, which can lead to some birth defect, developmental delay, or there is heart disease is there, and there is another growth factor is now reducing, the proper growth is not achieved due to that Down syndrome. So these are the bunch of signs and symptoms present, and which are correlated with each other. Okay. So this is syndrome, where a group of signs symptoms can be present. Okay. So this is Down syndrome, where you can see that asymmetrical face is also noted, and also there is growth is not that much proper, and also there is also the developmental delay, mental retardation, this can be seen. Okay. So this is the person who is affected by Down syndrome. His face is not looking normal like us. Okay. And another syndrome is HIV. HIV is a virus, and which leads to AIDS, acquired immunodeficiency syndrome. Okay. So in AIDS there is multiple symptoms can be seen, like weight loss, and if someone is having any infection in the body, then that infection will not get treated in the time, because those HIV virus attack the T cells, helper T cells, so that the immune response or immune system get weaker. So it leads to certain changes in the body. Okay. Over sweating is there, fever is there, like this. So this is AIDS. This is also a syndrome. It's not a disease. Okay. So that's all, friends. Thanks for watching, and please don't forget to like my video and subscribe to my channel, and I hope that this video help you to differentiate different types of terminologies which are used in medical science. Okay. So thank you so much.